Welcome. I know we have some people who are joined with us already and some will be joining soon. Welcome to the Together Women Rise May webinar. My name is Susan Klein Rothschild, and I'm a member of RISE's Board of Directors, and I'll be the moderator for tonight's event. Whether this is your first RISE webinar or you've been here many times, we welcome you and we are delighted to have you with us. Tonight, we have two special guests and topics, and let me share a little bit about the topics, but first share a little bit about Together Women Rise. Together Women Rise is a powerful community of women and allies dedicated to achieving global gender equity. Together, we learn about and advocate for gender equity issues. We give grants to organizations such as the ones we have with us tonight. And we work to make meaningful connections with people and make a difference for women around the world. Each month, we feature a specific issue and discuss a project or organization we are funding. Before we get into hearing from our guests, I just have a few reminders for Zoom. Please keep yourself on mute when speakers are speaking. There will be time for questions and answers after the speakers. You can use the chat function in Zoom and write your questions and we can keep track of those. We'll do our best to get as many questions as we can. And also there's a closed captioning feature that's been enabled for your use. Just go to your Zoom toolbar and click on the show captions and you can see it there. So now I want to turn to our speakers tonight who've graciously given their time to us. Tonight, we're focusing on two grantees. One is the Fistula Foundation and the other is One Heart Worldwide. Every month, Together Women Rise features projects that address one of many challenges faced by women and girls in low-income communities in the Global South. Tonight, we're focusing on two grantees that are focused on maternal and newborn health. With May being Women's Health Care Month and Mother's Day this month, our conversation is very timely and appropriate. So before we begin, let me put a little bit of information for you about maternal and newborn health in perspective. Although important progress has been made in the last 2 decades in reducing the maternal and newborn mortality rates, there are still gaps and inequities in terms of access to and quality of care. In 2020, a maternal death occurred almost every 2 minutes. That's about 287,000 women globally who died during and following pregnancy and childbirth. And the first month of life is still the most vulnerable period for child survival, with 2.3 million newborns dying in 2022. That equates to nearly half of the deaths of all children under 5. That means approximately 6,300 newborns die every day, most in the first week of life. That's 6,300 newborns every day. What saves the lives of newborns and mothers and prevents these injuries and these issues? It's really access to skilled care. And that's what's provided by these two organizations we're going to hear more about tonight. Both of them serve women and children and dismantle the barriers to healthcare for low-income and marginalized women and newborns, moving the needle on preventable deaths. So we have a long history, Together Women Rise, working with these organizations, one that dates back to the beginning of our organization. We first funded Fistula Foundation in 2004 and One Heart Worldwide in 2006 and have made multiple grants to these organizations over time, including about $350,000 in the important work being done by these two organizations. Now that you've had a brief introduction to this important issue, we're going to play a short video from these incredible organizations. Then we'll have a conversation with our guest speakers, Hannah Garone and from the Fistula Foundation and David Murphy from One Heart Worldwide. Sarah, you show us the video, please?
Hi, my name is Margot Bradley, and I am a volunteer member of Together Women Rise's Grants and Partnership Committee. The GPC is a dedicated team of Rise volunteers responsible for reviewing, screening, and vetting the applications for our featured grants program. As I'm a retired midwife, I was asked to present our two grantees for May, One Heart Worldwide and the Fistula Foundation. We've combined these two grantees because they both address issues related to maternity care. Healthcare, as you know, is a basic human right, and healthy women and girls are the cornerstones of healthy societies. But around the world, too many women lack access to services, especially those living in extreme poverty in remote and rural areas around the world. While there has been substantial progress made over the past 3 decades in reducing global maternal and neonatal mortality rates, there are still gaps and inequities in terms of access to and quality of care. Our grantees this month address these gaps. Many of you are already familiar with these organizations as we have a long history with them. In fact, our support for both of these organizations dates to the early days of our grant making. One Heart Worldwide is an organization that saves lives and promotes the well-being of mothers and their newborns in underserved areas of rural Nepal. Our new grant will be used to expand the simulation-based mentorship program for maternal and newborn health providers. This proven program, called Helping Mothers Survive and Helping Babies Breathe, was developed by the World Health Organization in conjunction with the American Academy of Pediatrics and the Johns Hopkins Program for International Education in Gynecology and Obstetrics, also known as JPIGO. Simulation programs are the most effective training methods for reinforcing hand skills, as rehearsed teamwork and muscle memory kicks in even in an emergency situation. This program will improve the skills of over 70 maternal child health workers located in the rugged terrains of rural Nepal. The Fistula Foundation is a global leader in fistula treatment, providing more reparative surgeries to women than any other organization. Obstetric fistula is an abnormal opening that occurs during an obstructed labor between a woman's genital tract and her urethra, bladder, or rectum. Women who experience obstetric fistula suffer from constant incontinence, shame, social segregation, and ongoing health problems. Obstetric fistula is rare when a laboring woman has access to timely, high-quality medical care, including cesarean section. The women at most risk for obstetric fistula are very young, almost girls, having their first baby, experiencing lifelong malnutrition, and living in very rural areas. Our grant will support the organization's expansion into rural Tanzania with surgical training and media awareness campaigns. These two grantees are working to ensure that women, especially mothers, can get the health care they need. And how appropriate is this for the month of May, when we are all celebrating Mother's Day on May 12th. If you are looking for a Mother's Day gift, please consider shopping on Together Women Rise's online marketplace. Another way to honor your mother or all mothers is by making a tribute gift to Together Women Rise. Honor your mother, mother-in-law, grandmother, aunt, sister, or any special person in your life, and you can visit our website for more information. Thank you so much, and enjoy these videos from One Heart Worldwide and the Fistula Foundation.
In the remote villages of Nepal, access to healthcare is a formidable challenge. For generations, communities have grappled with the scarcity of medical professionals and facilities, leaving residents vulnerable, especially women and children. At One Heart Worldwide, our mission is to save the lives and promote the well-being of mothers and newborns in underserved areas of Nepal. Recognizing the pressing need for enhanced training and resources, we partner directly with local communities to transform their healthcare infrastructure by renovating health facilities, providing medical equipment for birthing centers, and training healthcare providers. With the support of Together Women Rise, One Heart Worldwide is extending its simulation-based training program to nurses in Nepal's Mahotari district. During our many years of working across Nepal, we saw the need for better support and training for skilled birth attendants. The simulation-based training program developed by our team is an initiative that allows nurses to hone their clinical skills and decision-making abilities by bridging the gap between theory and practice. By using lifelike medical mannequins, which are a very close representation of real women and infants, nurses practice all sorts of essential techniques like taking blood pressure, managing hemorrhages, and helping newborns breathe.
Simulation based mentorship प्रोग्राममा जोडिएर एज अ मेन्टरको रूपमा काम गर्दै गर्दाखेरि चाहिँ मलाई मेरो आफ्नो सेल्फ कन्फिडेन्स एकदमै कन्फिडेन्स लेभल बढेको छ अनि हामीले चाहिँ केसहरु म्यानेजमेन्ट गर्दाखेरि चाहिँ कसरी गर्ने भन्ने कुराहरु चाहिँ सिकाउनलाई चाहिँ एकदम सजिलो भएको छ र आफुलाई पनि कुनै पनि केस हामीले चाहिँ यसमा रियल सिनारियो अन्तर्गत काम गर्ने भएको भएर सिमुलेसन गर्ने भएको भएर चाहिँ के रे केस म्यानेजमेन्टमा पनि एकदमै सजिलो भएको छ
डाइरेक्टली पेशेन्टमा गएर गर्नु भन्दा पनि पहिला अगाडि मोडुलमा चाहिँ गरेर देखाउनुहुन्छ मलाई चाहिँ पहिला एक्लाम्सिया प्री एक्लाम्सियाको बारेमा चाहिँ अब कसरी म्यानेज गर्ने भन्ने चाहिँ अलिकति कन्फ्युज थियो तर अहिले चाहिँ अब म्याग्नेसियम सल्फेटको डोजेसहरु लोडिङ डोज मेन्टेनेन्स डोजहरुको बारेमा चाहिँ एकदमै क्लियरली भनिदिनु भयो अनि ब्याग एन्ड मार्क्सको कुराहरु हरेक कुराहरु एकदमै राम्रो थियो
उहाँले चाहिँ हामीलाई के भन्नुहुन्छ भने सधैँ चाहिँ यहाँ जे गर्नुहुन्छ त्यही पेशेन्टलाई पनि त्यही एप्लाई गर्नु अनि बल्ल तपाईहरुलाई चाहिँ बानी पर्छ भन्नुहुन्छ त्यही अनुसार चाहिँ हामीले चाहिँ त्यही यहाँ जे सिकेको छ त्यही सकेसम्म चाहिँ आफ्नो प्र्याक्टिकलमा पनि हामीले उतार्ने कोसिस गर्छौं त्यही भएर पनि जो बिर्सिन अलि गाह्रो नै हुन्छ जो सजिलो भइराछ लर्निङमा यो चाहिँ म चाहिँ एकदम धेरै जरुरी छ भन्छु किनकि पालिकाहरुमा यताउतिमा चाहिँ हामी यहाँ त एटलिस्ट एसबीहरु सबै एसबीहरु प्लस गाइनेकोलोजिस्टहरु सबै अवेलेबल हुन्छ नि त त्यहाँ त आफै कन्फिडेन्ट भएको झन् राम्रो यहाँ चाहिँ जुन यो प्र्याक्टिकल वाइज यो आर्टिकलहरु इन्स्ट्रुमेन्टहरु अनि प्लस यो सिकाउने प्रोसेसहरु देख्दाखेरि चाहिँ मलाई उहाँलाई पनि त्यसरी नै यो प्रोग्रामहरु चाहिँ त्यहाँ पनि उहाँलाई पनि अवेलेबल गराइदिनु होला हुनेछ भनेर पनि मलाई आशा प्लस यो चाहिँ एकदम निड छ उहाँलाई चाहिँ
Over the next 2 years, we will train 10 master trainers who will then go on to train and mentor 70 rural healthcare providers who work with pregnant women and their babies. The impact of these efforts is massive and profound, as the skilled birth attendants and other healthcare professionals trained under this grant will ultimately serve a population of 28,000 pregnant women and newborns every year across Mahodari. By empowering healthcare providers within their own communities, we ensure that women can safely navigate childbirth with the help of a trained professional, despite the obstacles posed by geography and infrastructure. These experiences of skilled birth attendants serve as a testament to the transformative power of education and collaboration in improving maternal and infant healthcare in rural Nepal. Together with the support of One Heart Worldwide and Together Women Rise, these dedicated healthcare providers are paving the way for communities across the region towards a healthier future for generations to come.
Hello, Together Women Rise. I'm Kate Grant, CEO of Fistula Foundation, and I'm excited to tell you about the important project that Together Women Rise is funding in Tanzania. But first, let me tell you about obstetric fistula and our work to heal women who suffer from this heartbreaking condition. Obstetric fistula is a childbirth injury that happens when a woman has an obstructed labor but cannot access emergency help, like a C-section. The result is a fistula. It will leave her incontinent and all too often an outcast in her community. At Fistula Foundation, we believe that no woman should have to suffer a life of misery and isolation simply for trying to bring a child into the world.
The only treatment for fistula is surgery. And when it is done, it transforms their life.
That's why we've built a network of surgeons and hospitals providing fistula treatment to women in 30 countries in Africa and Asia. A surgery that costs as little as $619 can give a woman the priceless gift of health. Thanks to Together Women Rise, we are accelerating our vital work in Tanzania. About 50% of women in Tanzania deliver their babies at home without a skilled birth attendant. Home births are especially prevalent in rural communities where women lack access to emergency obstetric care. This is a significant risk factor for obstetric fistula. What's more, Tanzania has a vast geography, which makes it more difficult for women with fistula to access treatment. Women there suffer for 8 years on average before finding help. Many of these women are shunned by their communities and abandoned by their husbands. Many are unaware that their condition is treatable and isolate themselves out of shame. In July 2023, we launched the Fistula Foundation Treatment Network in Tanzania to reach these previously unreachable women and connect them to timely, high-quality care. Before they can be treated, women must first learn that a cure for their condition is possible, and they must be given the resources to access treatment. Our partners in Tanzania deploy outreach workers to affected communities and conduct awareness campaigns to find women in need of care and bring them to hospital facilities for free treatment. Community health volunteers are trained to carry critical messaging about fistula to rural villages. Over the next 2 years, Together Women Rise will help our partners train 230 community health volunteers and patient ambassadors, and will also support the purchase of radio spots to educate communities about fistula treatment options. Specifically, your support will fund the activities of 2 of our hospital partners within our countrywide treatment network and will enable the referral and treatment of 860 women. Your support will galvanize our new, fast-growing network in Tanzania and ensure that we can connect more women to the care that they deserve. Thank you, Together Women Rise. You are transforming lives.
Thank you. Exciting projects and programs and organizations. So I would like to say I want to give a very brief introduction to our guests so we can hear from them because it's really a lot to learn tonight. We're pleased to have both Hannah Garone and David Murphy with us. Hannah Garone is the Director of Strategic Partnerships at Fistula Foundation. In her role, she facilitates connections with stakeholders and grant makers to identify opportunities to support the Foundation's work to end suffering caused by obstetric fistula. She began her work at the organization as the Donor Relations Manager, and she has prior experience in community partnerships recruiting as an AmeriCorps organization. She holds a Bachelor's of Arts of Sociology and with a specialization in health and environment. Thank you, Hannah, for joining us. And we also have David Murphy. He's the CEO of One Heart Worldwide. Prior to joining One Heart, David was executive director of UCP Wheels for Humanity in Los Angeles, where they distributed wheelchairs and other mobility devices to low and middle income countries. Before that, David was involved as executive director for the International Rescue Committee and refugee resettlement offices, including San Diego. He has extensive experience in the International Resettlement Committee in various countries, and we're very lucky to have him with us tonight. Thank you both for joining us. I'd like to begin by asking questions of Hannah, and then we'll turn to you, David. Hannah, the Fistula Foundation is the global leader in obstetric fistula treatment, providing more surgeries to more women than any other organization. Could you please talk a little bit about what this injury is, why this is so important, and what your organization does?
Yeah, absolutely. So as you heard in some of the videos, but just to kind of go over it again, obstetric fistula is a childbirth injury that develops as a result of a prolonged obstructed labor. And women facing obstructed labor in the US and in the Western world have access to a C-section if they need it, but women living in rural areas with poor access to healthcare far away from the nearest hospital or unable to afford care in the first place are not able to get a C-section. And so they are that's the population that is at high risk for developing obstetric fistula. So in the case of a woman with fistula, during their prolonged obstructed labor over the course of 2 days, 3 days, sometimes more, the baby presses against the tissue of the birth canal. The baby is stuck and the tissue loses blood flow. And so the tissue dies and a hole develops. And this hole is what causes incontinence. And so women are leaking urine and feces uncontrollably. And the only cure for fistula is surgery. And so that's what we do at Fistula Foundation. And just to quickly address, I saw this question in the chat: do babies delivered by women who experience fistula generally survive? Tragically, in 90% of the cases where a woman develops obstetric fistula, the baby dies. And so not only are they left with this debilitating condition, but they're left with this experience of the traumatic birth and the sadness of losing their child. Why it's prevalent in the countries where we work is, we work in areas that don't have access to maternal health. So women living in rural, remote areas who are poor, they can't afford treatment, they can't afford giving birth in a hospital in the first place. And oftentimes there are different beliefs and customs about childbirth, where a woman is giving birth at home. And just generally, there's a lack of skilled birth attendants and midwives. So there's, as a result, a lack of understanding around the risks of childbirth and labor at home. And an additional risk factor for women developing obstetric fistula, really girls developing obstetric fistula, is early marriage. And so, when a girl gets married early, resulting in getting pregnant early, getting pregnant young before she's fully developed, this underdeveloped pelvis kind of contributes to birthing complications and obstructions and prolonged labor. So girls who are underdeveloped are at a higher risk of developing obstetric fistula. And so just kind of a lack of understanding of where fistula came from and its connection to childbirth as a result of the obstructed labor. Oftentimes women don't understand the connection that this is a result of the labor that they had, this development of the fistula. And so there's this stigma around it, a lack of understanding because of the unclean nature of the condition. They're leaking urine, they're leaking feces, they smell, people don't want to be around them. Many women think that they're cursed. Many communities tell the women that they're cursed or that they're witches. And unfortunately, these women also are lacking other resources in these poor rural areas, such as running water, a rotation of clean clothes, diapers. And so everyone around them is aware of their smell and their leaking. And they're unable to work, be connected with their lifeline, and they're kind of shunned from their communities and oftentimes abandoned by their family. And the hope in all of this is that it can be cured. There's a surgery that surgery is very straightforward in most of these cases. And it's just a matter of identifying these women who have cases of obstetric fistula, getting them transported to the hospitals where they can receive the surgery. And so that's the amazing work that our partners do and the work that we support, thanks to our donors and grants like this one from Together Women Rise, so that we can heal these women and kind of give them another chance at life.
Thank you, Hannah. A little follow-up question on that. So you work with organizations, local organizations. Could you talk a little about how does this work on the ground?
Yeah, of course. So we know that local experts know their communities best and their populations, the challenges that they face, and the cultures themselves. And so this utilizing local experts really helps us reach women and empowering these local partners. So they speak the language, they understand the culture, they also understand the stigma around fistula and the barriers to treatment that women face. So the way that our model works is that we identify surgeons who are doing this great work already, and we amplify their efforts. And we identify these community-based organizations who already have networks within the women in their communities, and we amplify their efforts. So we empower them to do the surgeries, to do the outreach, who, you know, otherwise these women wouldn't be able to afford the treatment. And we're enabling these surgeons and these community-based organizations to make a living by treating women with fistula, which, you know, what better motivation than that? And so we find our partners generally through referrals within our own network. You know, our network of surgeons or partner organizations recommending others who are doing this work. But we also work with FIGO, which is the International Federation of Gynecology and Obstetrics, to connect us to new surgeons, because some of the challenges we face, and I'll talk a little bit more about this later, but it's just finding surgeons who are willing to do this work. So we're trying to target fellows who are in countries where we're working, to try to, you know, find OBGYNs and get them specially trained in fistula surgery. So, yeah.
Wonderful. So you're working with local organizations and people who already have expertise in building on that. What about this specific grant in Tanzania? How will that grant work?
So this grant is going to be funding community health volunteers, patient ambassadors specifically, and the radio ad. So we saw a little bit about this in the video just now, but kind of the challenge is that these women live in remote places, and the lack of understanding and the lack of knowledge about the condition is what is preventing them from seeking treatment, and even just being a part of their community in the first place. So, you know, many are aware that their condition is fistula, that it's related to childbirth. Many of them have been turned away from doctors who couldn't provide specialized treatment or weren't able to identify this as a case of fistula in these cases where women were able to go see maybe a local doctor. And there's just kind of misinformation about the cause of fistula in general. So maybe that they have bad luck, it's a consequence of bad or evil actions, that they're cursed, all these different misunderstandings and misinformation. And, you know, there's this large stigma from incontinence, which I mentioned earlier. So there's a huge value in getting these community health volunteers and patient ambassadors trained, which is a large part of what this grant from Together Women Rise will be doing. And this is specifically at our newest Fistula Foundation treatment network in Tanzania. So we're really trying to expand and reach out to more and more women so that we can get more women healed here. And, you know, the community health volunteers, they're locals in the community who can kind of bridge that gap of understanding around fistula. And they are trained, the training that they get, that's part of this grant, is to help them identify fistula cases by understanding and detecting the symptoms themselves. And they're able to screen for potential fistula sufferers. And they also provide mental and emotional support with therapy and things like that. And so, you know, women with fistula, they also worry about traveling far from home for a surgery, for a condition that they just learned about. They're afraid of the risk. They're afraid of kind of leaving everything that they know. And they don't necessarily trust, like, hey, everything's going to be free. Everything's going to be paid for. And so they have this kind of mental barrier that our community health volunteers and patient ambassadors are trained to address. And I think the special value, the thing that's particularly valuable about patient ambassadors, is these are women who have suffered from obstetric fistula themselves. And so they can share their story of hope and let women know that, yes, this actually is free treatment. Like, I am, you know, somebody that they know from their village, a local, maybe someone from the village over, that got a bus to take them to this hospital where treatment was completely free and everything is okay. And they're back now. They can really empathize with their situation. And they can really identify with the experience and provide that unique type of support. And so, you know, both types of workers are also there to help educate the community, to provide better understanding of fistula and its cause, to decrease the stigma that surrounds it and kind of increase the understanding of the woman's condition, as well as not just about fistula, but giving information about maternal health care and about reproductive health. So it's really beneficial for these communities to be able to have discussions and to engage in the learning so that they can spread this vital information about maternal health care and fistula treatment. And just to touch on the radio ads quickly, these really allow us to inform people where we don't have as many boots on the ground, where we don't have people going out into the villages necessarily, or maybe somebody missed the day where somebody was out doing outreach, and just create more widespread awareness. And I've heard lots of stories from women about being told that there was free treatment available by a radio ad. They were able to identify with some of the conditions that they were describing. And so this Together Women Rise grant will help us find more women suffering from fistula, let them know that that treatment is available, that the free transportation is available, and that they have done nothing wrong to cause this condition, and really give them the hope that we can provide them with this free treatment.
Very exciting. I can really understand how the community health volunteers and the patient ambassadors can make a huge difference. Thank you, Hannah. I'm going to move to David a little bit now. David, with One Heart Worldwide, believes that no woman, no infant should die during childbirth. Tell me a little bit more about what your organization does in Nepal. We have a long history, obviously, with your organization, but could you share a little bit how you've grown and evolved?
So first of all, thank you very much for having us come to this evening. It's great to be continuing this wonderful partnership that we have with Together Women Rise. And so One Heart Worldwide has been in Nepal for the last 14 years. And when we first started, we were in just 2 villages to begin with. And over the time, we have developed what we call the network of safety. And this is where we begin with the federal government, and we identify the districts in Nepal that have the highest maternal mortality rates. And then we will decide to work there in conjunction with the government. And we are there to help build up the government system. So we're not setting up a parallel structure, parallel system. We have a 6-year model. And the first year we go out to a district and we do an entire assessment of the whole district, of all the villages, all the municipalities. We see what's there. Is there a health post? Is there a birthing center? Is there equipment? Is there skilled birth attendants? Just what's going on? Then we come up with a plan. Here's what we need to do. We need for construction and rehabilitation, and all of this requires a budget. So we request the government, the local government, the municipality, which are the budget holders in Nepal, to cost share with us 50%. So they have skin in the game. They have ownership of this project. And that takes time. They have to build it into their fiscal years and their budget cycles. So that's the first year. But then we sign an MOU and come to an agreement with all the activities that are going to take place. And then the next couple of years, that's when the implementation takes place. Construction, rehabilitation of birthing centers, equipping the birthing centers, training skilled birth attendants, female community health volunteers, and ensuring all the different community structures and management structures are in place to ensure sustainability of the birthing center. Then the final couple of years that we're working there, we slowly begin to exit. And we don't just leave right away, but we ensure that all the different pieces are still working. And if they're not, we can go in and help support the piece. We don't come in to fix it. We are there to help support the government to be able to fix whatever those pieces are that are not working properly, again, so that we ensure sustainability, but that we have an exit strategy from day one. And so the government knows we're only going to be there for a finite period of time. We're very focused on maternal newborn health. We don't do water and education. And while these sectors are very important, we're very specific and surgical about what we do. And over the years, as we have been in Nepal, we have developed this program, continued to refine it. We very much tailor our intervention for what each village needs, what each municipality needs. So it's not just one size fits all. And by the end of next year, we will have covered 36 districts in Nepal, which is half of all the geographic districts and approximately 1/3 of all pregnancies in Nepal. So a pretty large scale that we are looking at. Currently, maternal mortality rates are 151 per 100,000. That's still pretty high. And so that's why we're focusing on this, because again, We believe in a world where all women and newborns survive and are healthy, and not only survive, but can thrive. So that's our network of safety. That's our base model. And then we have other components that fit onto it to help strengthen our maternal newborn health.
Thank you, David. Your organization takes the long view, right? The long perspective, and is really looking at broad impact. A key part of the process is this simulation-based mentorship program. Could you talk a little bit about how that works?
So a skilled birth attendant is, in general, a young woman that has completed university, nursing school, and then will complete a 4-month skilled birth attendant training. Then she is sent out to the field. Again, these are very remote, rural Nepal municipalities, birthing centers. You saw quickly on the that video we showed the geography of Nepal. It is not easy to get around, and so the idea is that these young women, these skilled birth attendants, do not access continuing medical education. So what we do is we identify a mentor, a woman that has a lot of experience around delivery, complications, and is interested to help teach the younger mentees. And then we pair them up. So there's one mentor with roughly 7 mentees in the same neighboring area. They get together once a month, and using these mannequins we have, they can practice their skills, and whether it's a normal delivery, but even more importantly, to be able to practice different complications that can happen. And then it's what happens if there is a complication? What do you do? Can you handle it? How do you respond? When are you in over your head and you need to refer this to the next medical facility? And so they do this every month. It's not just a one-off training, but it's a continuing medical education program that builds up their skill set and their confidence so that they can provide better quality services.
Great. I can really understand how that works and makes a difference. Do you encounter any challenges outsourcing or transporting these simulation pieces to different areas?
Absolutely. I mean, the geography of Nepal is extremely rough. As you know, that's the Himalayas. That's where Mount Everest is. And so we work in these mountain areas, but also what they call the hills, which are still mountains. And we work in very remote areas, very poor areas. Road conditions are very poor. Sometimes women have to walk for several days just to get help if there's no transportation available. And so there's emergencies, there's landslides where they actually will build a road into the side of a mountain. Villages are perched on the side of a mountain. So when they have a landslide, it's not just this little patch of dirt that came down, it will be the entire side of a mountain that came down, blocking off access to further villages for days and weeks at a time. There's also flooding and earthquakes that happen in our different program sites. In addition to, even though Nepal is a relatively small country with only 30 million people, it is very culturally different, all the different regions of Nepal. And so that's also another challenge that we face.
You face many challenges, but both organizations do such incredible work. We're just so grateful that you're doing and continuing what you do. I want to now ask a couple questions of both of you. And let me first turn to you, Hannah, since you've had a little bit of a break. What are some unique challenges and adaptations to healthcare services and training you've encountered in the regions you've worked? And I'll ask you to follow up, David.
Sorry, just finding the unmute button. So I think it kind of has many layers to it. And so some of the unique challenges is just access to maternal health care in general. These women, they're not really prioritized in terms of healthcare. These women who live in poor rural areas, they don't, they don't have the access to the healthcare in general. And from one angle, with their maternal care, when they're pregnant, they're not prioritized. And then when they suffer from childbirth injuries like obstetric fistula and becoming incontinent, dealing with the smell and the leaking, they're just very easily cast aside. And so other layers of inequality come into play here. In many cultures where the prevalence of obstetric fistula is high, it's normal for men to have multiple wives. And so if a woman develops obstetric fistula, she often gets abandoned after developing the condition and her husband gets remarried. And I mentioned this before, but overall, the lack of knowledge and understanding about this condition around the cause of obstetric fistula being related to childbirth, they face this incredible stigma, which is sort of a culmination of all of these different challenges that women face in the community. Because of this, they have this mental barrier to looking for treatment. And then because of the stigma, they don't want to share their condition. They're isolated. They're not really trusting that treatment is free. But then, of course, just kind of the barriers of access that anyone in their community faces due to being able to afford healthcare and then being able to access it just geographically.
Right. David, what would you say are some of the unique challenges and adaptations to healthcare services? Oh, mute. Thank you.
So one is that we need to be very flexible as far as what our interventions are. And when we first started many years ago, it was kind of one size fits all. And now we have changed our model so that we are very flexible to meet the needs of each different community, because each one is different culturally, economically, ethnically, I mean, in every way possible. And another issue in Nepal is just access and being able to have physical access to a health center, a birthing center. And over the years, we have actually built quite a number of birthing centers. Now we are starting to get away a bit from the actual construction and focusing much more on quality of care, the quality of service there. It's one thing to have a building, but then if it's empty or it doesn't have skilled trained birth attendants, or if it doesn't have the proper pharmaceutical medication or whatever. So these are the areas that we're looking at. In Nepal, still the number one cause of death for a woman is postpartum hemorrhage. And wow. So it can be prevented, provided you have the proper equipment and pharmaceutical. But in a lot of these areas, they still don't have it. So that's just like, for example, we realize this. So this is one area that we're really focusing in on, is to ensure that there are not stockouts of misoprostol and that there's the skilled birth attendants are properly trained to be able to deal with it. And I mean, again, it's something that you have to be able to respond to quickly, and not over days, but over hours.
Right. Great. Time of childbirth is supposed to be one of the happiest times of someone's life. And look at these issues that can come and that they can be addressed is so important. So important. I'm wondering if each of you, first starting with Hannah, can share a personal story of a woman or a girl who has been impacted by your work.
Yeah, absolutely. So I want to share with you the story of Martha, who is a patient of ours in Tanzania who was referred to treatment through our Fistula Foundation treatment network, which is what Together Women Rise is helping to support. And so Martha was treated last year. She was diagnosed with obstetric fistula at 20 years old. I know we heard the average woman who suffers with obstetric fistula in Tanzania suffers for 8 years. Martha was able to be diagnosed after only just a year and 7 months with fistula, which, if you ask me, is still way too long. Nobody wants to be suffering from incontinence for that long. And so, of course, that's one of our goals, is to reach these women as soon as possible. Before Fistula, Martha was a businesswoman. She said that she had a good life and she was married. She was looking forward to starting a family. But during her childbirth, she traveled for 2 days while laboring to get to a hospital. On the third day, she was at the hospital. She was experiencing a lot of pain, but she wasn't being treated yet. And on the fourth day, they said that she needed to be operated on. And so after 4 days of painful labor, Martha delivered a stillborn baby, and she started leaking urine immediately after. And she didn't know that it was fistula. None of the hospital workers told her that it was fistula or that it could be treated. And so after she returned home and the leaking continued, she left her work and business completely. She was abandoned by her husband, and she went to live with her parents for over a year, out of work, dealing with their traumatic birth. And, luckily at least could go and live with her parents in the meantime. After this time, after about a year and 7 months, she learned about someone from her village who was treated in Dar el Salaam at a Fistula Foundation partner hospital, CCBRT. This is one of our longest standing partners in the Tanzania network. Last year, they performed about 1,000 fistula repair surgeries. So this is one of our huge partners there. So when Martha learned that she could be cured of obstetric fistula, she was both relieved and also terrified. She was very afraid of surgery, which would take place very far from her village. She traveled 2 days just to get to the hospital, had a very traumatic experience, and she was afraid that she might die from the surgery. But, with convincing from somebody who had a successful treatment, she took this leap of faith and she, walked down this unknown path so that she could find her healing. And she was provided with transportation to get treatment at the same hospital, CCBRT. Every fistula case is unique. One of the benefits of our work is that we provide specialized training for the different cases that can occur. And we want to bring in highly trained surgeons, and we'll occasionally bring in experts for more complicated cases. And in Martha's case, she actually had developed 2 fistulas and needed 2 separate surgeries. So she had 2 holes causing incontinence. But fortunately, she received the care that she needed, 1 surgery at a time, and she's now healed and completely dry. And in her recovery, when she was interviewed at the hospital, she shared that her dream is to start her own business. So thanks to the generous support of our donors and from Together Women Rise and others, we're able to connect women like Martha in Tanzania and across our different networks to the care that she needs.
Very exciting, Hannah. David, could you briefly share a personal story that you know of?
A young woman named Anita, 23 years old, graduated from nursing school, went to the skilled birth attendant training, was then sent out to an extremely remote area of Nepal by herself in a birthing center. All the responsibility is on her shoulders. And yet here she is, a young woman, only having delivered 4 babies in her life. And they were all normal deliveries, no complications, no problems, just a normal delivery. And now she's out in this extreme rural area, no support. And a pregnant woman comes in, she has a complication. Eventually, they are able to handle it, and both mother and baby survive. But it traumatized her so much that she was going to quit. She didn't want to be a nurse anymore. She didn't want to be a skilled birth attendant. She wanted nothing else to do with maternal and newborn health. But right then is when we began the simulation-based mentorship program. We were able to connect her with a mentor who began to work with her and a group of other similar young women, skilled birth attendants, and to be able to provide them this training, hands-on training, the mentorship, the coaching, the practice, and really be able to create this bond between them. So it's not professor-student or that type. It's really just a peer-to-peer, but a mentor in the truest sense. Fast forward 6 months, and Anita now she didn't quit. She's continuing to deliver babies, but she has this confidence now that she never had. And actually, when I met her and just talking to her about it, she had tears in her eyes from talking about her experience and how now she has this confidence. And how you give confidence to a young woman in this setting is wonderful.
Wow, hearing about Anita and Martha is so invigorating and so exciting. And knowing what you do as organizations, that RISE has an opportunity to contribute this and make a difference is huge. We have a little bit of time for questions and answers. Sarah's going to help look at some of the things that have come in the chat.
Yes, and Hannah's already been answering a few of these questions, so be sure to check out the chat and see some of the questions that have already been answered. But one of the first ones I saw was, does One Heart help the government reinforce the referral system for women who need emergency obstetric care in a hospital setting?
Repeat that last part of it again.
Sorry. Yep. Does One Heart help the government reinforce the referral system for women who need emergency obstetric care in a hospital setting?
Oh, absolutely. I mean, that's the whole point. Is so we are able to help them figure out, you're at this birthing center now, where is the next referral? And it really depends on the location, the geography, what the next best facility is. And so, for example, what we have done is, on the wall of every birthing center are a number of telephone numbers, and it starts with the local telephone numbers, the district telephone numbers, where the referral is, but also all the way back to Kathmandu. And so that once there is an emergency, that if there is no transportation available or they're figuring that out, the skilled birth attendant can also make phone calls, and it's right there. Like a dozen different telephone numbers right there for her easy access.
Thank you. The next question I have is also for you, David. What is your biggest challenge as you work in these villages to improve maternal health? I know you kind of talked about that a little bit already, kind of hinted, but if you want to like extrapolate a little bit more.
Biggest challenge is that we would love to do more. And so, but obviously funding is finite. And so that's why we just stay within our maternal newborn health. We do, like, for example, a little bit of reproductive health. So we do counsel the woman after she's given birth about, child spacing or birth control, or nutrition is also a big issue, and stunting is a big issue in Nepal. So there's quite a number of other activities that we could do, but due to limitation of funding, we stay very much finite with what we're doing.
And one more question for you before I switch to Hannah. Sorry, Hannah, you've answered quite a few of these already. So for David, have you considered naming your training midwifery instead of medical training? Can you talk a little bit about maybe the differences between the two, and if there's a movement worldwide, is what the commentator is saying, that's part of the midwifery movement. I didn't know if you have anything you can add to that, why you're naming your medical training that way. And
so we are using the government of Nepal's titles, and actually they don't have a midwifery program in Nepal yet. They are just getting started with it. To date, there's only 45 trained midwives in Nepal. Right now, they're depending on skilled birth attendants, which is actually a step down from a midwife. And so they do have a plan to begin to ramp up their midwifery program at the university level. So that's why we don't call it a midwifery program. It's a skilled birth attendant program.
Thank you. So Hannah, when you work in Tanzania, are you encountering a lot of people from the Maasai population, in addition to the other communities that you're working with there?
So I'll be honest, it's hard for me to speak on exact populations, just quickly like looking at a map of where our partners are. The closest partner that we actually have to the Maasai population would be Maternity Africa, which is one of the partners that the Together Women Rise grant is funding. And so I don't know about specifically like which communities we're doing outreach in, but I could ask our programs team and follow up with you.
Thank you. And one more question for David. Given the challenging terrain, limited resources in Nepal, how is the training and learning access to healthcare infrastructure sustained by the government? You talked a bit about how your relationship with the government works, but beyond, like outside of what you've already explained, can you tell us more about that?
So that's where this first year of our Network of Safety program is so important, because this is their program. This is their birthing center. It is their staff that are working there. We don't pay the salaries of the government staff, because what would happen is once we stop the program, we stop paying the salaries, those people would no longer work there. And then a lot of times then the program ends. So we're very specific about not paying for things that will stop once we exit. So that, like I said, from day one, we have an exit strategy. The government knows we're going to exit. And so we are just helping provide the building blocks of all those different pieces that we work on to ensure the sustainability piece, so that when we do exit, the program doesn't stop and the government just continues.
That makes sense. That seems to be mostly for the chat. Please let me know if I missed anybody, but we got through quite a few of them.
That's great. We are coming to an end of our time, and I want to be respectful of everybody who's given time tonight. Honestly, David and Hannah, we thank you so much. You personally have given your time and your treasure to these organizations, and these organizations have made a huge difference. We've just gotten to hear a little bit today about what they do and how they do, and Together Women Rise is really proud to support One Heart Worldwide and the Fistula Foundation, both of which are excellent. And I want to thank everyone who attended tonight, everyone who's a member, everyone who contributes to our organization, everyone who helps make it possible, who shares the information, helps make other people aware. There are many ways, if you want to continue to contribute or add, that you can do so. There's a celebration of giving summit that we'll have on May 7th through 9th. There's webinars every month, and there's one next month on June 6th. There's lots of trips that we have every year to see our grantees. And certainly there are more things you can learn about on our website on togetherwomenrise.org. Just click on that Join Us tab and then upcoming events. Thank you for joining us tonight, and I hope you can join us again in the future. Good night.
Thank you very much for having us. We really appreciate it. And thank you for we've had a partnership with Together Women Rise since 2006. And I mean, frankly, with just this little bit of money, we're going to reach 28,000 women annually. So just talk about impact for your money. So again,
wow.
Thank you very much, and happy Mother's Day.
Thank you, David.
Thank you, David. Thank you, Hannah.
Thank you, Hannah.
Yeah,
thank
you.
Beautiful.
Thank you for the opportunity to share about this work and for your support. And David, it was great to hear about your programs as well and the impact that you'll have.